part 2 about skin biology and perimenopause, I wanted to really touch upon what happens when some of these tissues that are very estrogen dependent start to lose them in perimenopause and menopause. I mentioned in the previous talk that in the first 5 years after menopause, we can lose up to 30% of our collagen. But all of the tissues in our skin actually have estrogen receptors and are sensitive to this. So what do we want to think about? So in terms of the skin cells, if they're estrogen receptive and they start to lose estrogen, how does that manifest itself? Well, full 20 to 40% of women will have cirrhosis, which is dry skin, and pruritus, which is itchiness, as we start to enter perimenopause and menopause. And that's a result of the keratinocytes and some of the structures that keep them together not performing as well. Well, and then I mentioned fibroblasts are affected by this. So how does that manifest itself? Well, they are the producers of collagen and elastin. And so as we start to lose collagen and elastin, we start to lose resiliency in the skin, and we start to lose some of the bounce back of our skin. I also mentioned that blood vessels are affected. So if we start to affect blood vessels, they are like the lifeblood of our skin. So we're going to see changes in the skin, as I've mentioned before, but also rosacea, the incidence of that redness in our central face, sometimes breakouts, broken blood vessels, that can increase over time as well. Melanocytes are also affected by estrogen. So there's a mixed picture there. Sometimes there's worsening of melasma, which is a pigmentary condition of the skin. And then finally, the hair follicles and the oil glands are affected by hormone receptors. And so how does this manifest itself? Well, in terms of the oil glands, we do get drier skin, as I mentioned. In terms of the hair follicles, we can see less robustness of our hair, or a sort of tip in an androgen excess. So we tend to get an androgen predominance, favoring, even though it may be low, more testosterone, more progesterone as a ratio to our estrogen. And this can manifest itself as hair loss. So combined, we want to be able to use topical skin therapy for the cirrhosis and the dryness, looking at things like ceramides, making sure that you have glycerin and hyaluronic acid and squalane in your topicals that you're using. We want to do things that help brighten and build collagen. So the use of retinoids, using a vitamin C or an antioxidant that's gentle enough. So I tend to like the fat-soluble forms of vitamin C as a result of that. And then I really love gentle molecules. So using things like peptides, growth factors, exosomes topically to help restore some of that collagen and elastin, in combination with many of the topicals that we kind of think of as just a sort of consistent therapy, like sunscreen, and then of course retinoids, because they've got 6 decades of research. The last question I get asked a lot in clinic with patients is about estrogen cream. So the research is really mixed there. There is evidence that estrogen helps build collagen and makes tighter collagen fibrils, which is the structure that keeps collagen together. But it's mixed. There are studies that actually show in photodamaged skin, so skin that's actually getting sun, that it doesn't have an effect. And there's an unpublished study with Premarin, which was the original estrogen that was studied for women topically in the crow's feet, and it found no difference in terms of crow's feet appearance or helping the appearance of the skin in the crow's feet region. So as a result of that, I really encourage patients that there are probably better options. You know, using sunscreen, using retinoids, using some of these growth factors, antioxidants that I talked about are probably far better than using the estrogen. But if you are using estrogen and you want to do that, you need to make sure that we're supporting it with other topicals, and absolutely you need to be using sunscreen, or you're probably going to negate some of the effects of that. So interesting thoughts. Let me know what you think and post a comment below. So part